My short answer is yes, unless there are extreme conditions such as very high risk of viral transmissions in oncology departments from several reasons, which is not existent for now. If you are given some sort of chemotherapy, you might have some tendency to bacterial and viral infections, including coronavirus infection. So you should be more cautious than healthy people. What is more important is the outcome of disease in cancer patients might be worse than it would be in healthy people. No, you don't have increased risk. But if you have follow-up visits, I would recommend you cancel or put off your appointments. They are usually not necessary at that moment. But before doing that, please consult your oncologist. In general, it is not necessary to wear a mask at home or in open air. But in that period of time, when you go to hospital, and if you use public transport, I recommend you wearing a mask. By the way, I would recommend not to use public transport as much as possible. But if you have no other choices, at least use a mask. As it comes to surgical gloves, never use it. It will not prevent you. Just wash your hands properly. There are two rules. If you closely follow these two rules, you will almost never get this infection. Rule 1, never touch your face, especially your mouth and nose, unless your hands are clear. You have to make sure properly washing or sanitizing your hands before touching your face. Rule 2, keep your social distance. Stay 6 feet or 1.5 meters away from anyone else. If you follow these two rules, you will never get this infection. If you are living in a family, make sure every one of your family members follow these two rules. If any one of your family member does not follow these two rules, you might be under risk. The super rule is staying at home. However, if anyone in your family, your wife or your child has to work, you should never use the same stuff such as towels, spoon, glasses, dishes, etc. Use paper towels if possible. Stay in an isolated room if possible. Keep your social distance even at home and ventilate your home frequently. If you take these precautions, probably you won't get this infection. Honestly, I don't recommend to use any vitamin supplements. There are no hard evidence regarding their use yet. Don't waste your money. There are only 3 proved ways of boosting your immunity. The first and the most important one is regular daily sleep, at least 7 or 8 hours a day. Second, to work out regularly, at least 30 or 45 minutes a day. You can do that at home in several ways, but if you don't have an indoor bicycle or treadmill, you can find a lot of materials on YouTube or Google. Third one is a balanced diet. What I mean by balanced diet is to take enough protein, vegetables, and some kind of healthy carbohydrates, which are the stuff that have lower glycemic index, and also avoid simple sugars as much as possible. Follow these 2 rules and always remember the super rule. Stay at home. Stay at home. Stay at home.